Very good morning, the delegates and the respected judges, and thanks for AIOS for presenting our work. That it is visual field indices in children with glaucoma compared to that in an adult glaucoma patient with comparable RNFL thickness. I have no financial interest to disclose. So we know that in clinical practice, the visual abnormalities in children with glaucoma are compared with adult normative data because there is a lack of normative data for the children. So the optic study showed that the children do not attain the adult visual field sensitivity till at least 12 years of age. And an abnormal visual field measured in the child may be normal for that age group since the sensitivity compared with the adult normative value. With this background, we studied, our aim was to determine the visual field defect and visual field defect detected on the Humphrey visual field in child with glaucoma and compare with the adult glaucoma with same similar RNFL thickness. So the informed consent was taken from the parents and the study was cleared from the Institute of Ethics. And this is a prospective observational cross-sectional study, and the children between 6 to 18 years were aged with glaucoma as per CGN criteria were included, and the inclusion criteria was children with glaucoma more than 20/40 vision acuity and the clear media, ocular media, and the exclusion criteria was any attention deficit syndrome or any disease which known to affect the visual field of the child. So all patients underwent visual field testing on Humphrey and the RNFL thickness was measured on the OCT. Adult glaucoma patient who had previously undergone visual field testing and were retrieved from the database. And for every child enrolled, a glaucoma patient with same RNFL thickness were identified and the only reliable visual field were included for the analysis. The mean outcome measure was mean deviation, pattern standard deviation, and for the child. And the children between children were classified as children less than 6 to 11 years, and children was 12 to 18 years were analyzed separately. The minimum sample size required were 17 patients per group, and relevant stats were used. We have 46 eyes of 37 children with glaucoma compared with RNFL matched adult. The mean age was, the diagnosis were predominantly PCG in smaller children, whereas the juvenile open angle glaucoma in elderly children. And the logMAR vision acuity and the IOP were comparable in both groups. The average RNFL thickness was 72 micron and 68 micron respectively, and they were comparable. Now note that the mean deviation of the younger children was much better as compared to the older children, and also the PSD values of the older children are much higher as compared to the elderly children. Now when we compare the similar same patient with comparable RNFL thickness, we could find that though the mean average thickness was similar in all the groups, we could find that the mean deviation of the children was much higher. That means the children have much worse functional analysis as compared to the adult counterpart. And also we have the children have much higher PSD as compared to the adult patient with similar kind of RNFL thickness. Of course, the adult performed the visual field faster as compared to the children as we expected. Here I have a 10-year-old boy with PCG and 15-year-old patient with steroid-induced glaucoma and an adult 65-year-old adult with a similar RNFL thickness. Now he could notice that even though our mean average thickness was similar, the children have worse mean deviation, as could see the mean deviation plot of the children. So to conclude that the children between 6 to 18 years appears to have worse mean deviation and PSD as compared to adult. And the children may be wrongly labeled as more severe glaucoma due to lesser MD when assessed in comparison with adult glaucoma database. So we recommend to consider developing a separate pediatric normative database for the visual field assessment field children less than 18 years of age. Thank you for your kind listening.
Thank you for excellent presentation. Is it possible that the visual field in children were not very reliable compared to adults?
We took only reliable visual field for all the children. We will repeat it multiple times till getting a reliable visual field as a definite for the definite criteria for the study. All the patients were reliable. Especially, of course, the children less than 11 years will be difficult to get, but we usually get, once we do that at least 2 to 3 times if we repeat, they will learn actually.
Okay. Thank you.